pregnant, you're having a baby, there are so many things you have to decide, and each decision seems so important. It's hard to kind of decide which one's more important than the next. Everything is overwhelming. And I remember cord blood banking being particularly difficult to make a decision about because it was a very emotional decision as well. And it was very mysterious because there's a lot of science around it. So I'm here today with Kate at ViaCord to get some answers about cord blood banking and demystify the process. So Kate, thanks for having us. Bottom line, just so I understand as a parent, these stem cells can potentially be used to help my child if they get sick.
Right.
As a parent, it feels very powerless when your child is sick.
Absolutely.
So to have a potential option,
right.
I think provides some comfort. So how many families have banked in your bank?
So there's over 350,000 babies' cord blood units that we have stored in the bank right now. And it is a bank because we're storing something very valuable for safekeeping for a long term.
Okay, so you've done it.
Mm-hmm.
You've banked the stem cells. Nobody likes to think about the scenario, I imagine, in which you'd want to use them, although if you do need to use them and you have them, you know, it's a great answer, I guess, your prayers at the time. So can you tell us a little bit about why would the stem cells be used for the child that they were collected from?
So over 300 of the units have been released to be used, and over 120 of those are units that were used for the child that they came from, which is largely in clinical research trials. There's one going on right now on cerebral palsy, autism, and in all those cases where there are novel applications, these children have to have their own cord blood to be used.
So that's important because I know that I heard these stem cells could only be used for another sibling or for somebody in the family, so not for that child. So that was something to consider, but that's not true anymore.
It's it never was. It's always been able to be used for both. It really depends on what you're trying to treat. A lot of the nearly 80 diseases that are treatable with cord blood stem cell transplant.
80?
Nearly 80, yes.
So nearly 80 diseases already. This is already out there. It's not trials. It's nothing. It's legitimately being treated.
So those diseases are largely made up of different types of cancers, immune disorders, bone marrow failure syndromes, and a lot of them are genetic. And in those cases, you would look to find a match or a donor to have the stem cell transplant. The best chance of finding a match is going to be from a sibling, from a brother or a sister.
That's amazing. And then on top of that, there's
the research for the novel applications. Yes.
How is cord blood actually collected?
From beginning to end, the process takes about 5 minutes. You know, as I mentioned, the baby's born, and we decide when you want to have the cord clamped, and then doing the collection. Just really just patience. It's a gravity process, so it just flows out of the cord right into the bag. We also have the ability to bank the umbilical cord tissue. We can take that and process stem cells out of the tissue. It's a different type of stem cell, and there's some very exciting work going on with the stem cells you find from the cord tissue.
So what happens when a family needs to use their cord blood?
I talk to a lot of families who call in thinking that they might need to use their cord blood stem cells. Many of them go on to use the stem cells, many of them do not, but each family you talk to is in some sort of crisis. Someone that they love is sick, and they're wondering if they can use the stem cells for a treatment. So it's partially our job to talk to the family and then maybe talk directly to their healthcare provider that's treating their loved one to figure out if it is a scenario where stem cells make sense or maybe not. So we do kind of hold their hand through that process.
What do you wish people knew about banking that maybe they don't?
At the end of the day, the thing that I wish everybody knew is that it's an option, and what their options are, and that there's value in the umbilical cord blood. I talked to so many people who have just had a baby and said, oh, I wish I had known. And they just didn't know anything at all, and so therefore nothing was done.
Well, this was enlightening. So we know the time that you can get those cells and delivery, a safe place to bank, and all the amazing research that is going on both for siblings but also for the child who sells the stem cells that were banked. So thank you for talking to us, and it's clear that you have so much passion. So as a parent, when you think about this, it's really nice to know the people you're working with are as passionate as you.